On this Tuesday night, Nova Scotia RCMP under intensifying scrutiny. Why didn't they request an emergency alert when a mass murderer was on the loose?
Well, that is something that all Nova Scotians are wondering.
New details about the innocent lives lost.
She was a beautiful human being.
The growing death toll and the renewed focus on gun control. Doctors and nurses' orders. Quebec's new investigation into how COVID-19 is devastating care homes. And stitching together a Canadian solution.
I'm really proud to be a part of this.
A common thread between these face mask makers.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin in Nova Scotia, and questions about whether lives could have been saved in that shooting rampage had an emergency alert been issued, warning people an armed and dangerous man was in the area. The RCMP now say they believe 22 people were killed, plus the gunman, leaving the possibility open there could be even more victims found. Among those being mourned are healthcare workers, a teacher, an RCMP officer, a 17-year-old, all of them victims of the worst mass killing in Canadian history. The RCMP didn't hold a briefing today. They did issue a release. It says the first call came in at 10:30 on Saturday night, a firearms complaint in the town of Portapique. On Twitter, the RCMP advised the public to stay inside and lock their doors. When police arrived, the gunman was gone and there were casualties inside and outside the home. The gunman kept roaming through the night, but an emergency alert was never issued. Nova Scotia's Premier, Stephen McNeil, says the Emergency Management Office was ready to issue one, but did not get a request from the RCMP.
Our EMO center was activated, has been activated. We brought in staff that had come in, those that especially deal with the alert system. And we need to be the lead agency. In this case, the RCMP has to ask for that alert to go out. But we had staff on hand in the morning to be able to do that, but it was not requested.
The RCMP say the gunman was wearing an authentic police uniform and driving what they call a very real look-alike RCMP vehicle. They say he did not have a criminal record. RCMP say 13 and a half hours passed from when the first call came in to when the gunman was shot by police and later died at a service station in Enfield. The RCMP aren't speculating on his motives, and we have been asked why we've shown his picture and used his name. Well, we're being careful to limit how often we do that, but we're not going to withhold any information because he is responsible for multiple murders. And with 16 crime scenes, there are many unanswered questions, including about the police response. Ross Lord has covered this story since it broke and begins our coverage tonight.
This country road is popular for walking. Now, in the small community of Wentworth, Nova Scotia, it's a symbol of randomness. David and Heather Matthews decided Sunday morning to alter their normal path.
I come out of the driveway and I said, no, I'm not walking down the road. And I don't know why.
That decision might have saved their lives. Minutes later, they heard the sound of what they now believe was a gunshot that took the life of Lillian Hislop, who was also a regular walker.
Lillian was a gentle person, sweet lady, very community spirited. She walked almost every day.
Heather Matthews feels if RCMP had initiated a widespread warning instead of using primarily Twitter, the outcome could have been different.
I was wondering why we could not have received an alert of some kind. We get COVID-19 alerts, we get Amber alerts, some kind of an alert to warn us that there was someone loose, and that perhaps if that occurred on our devices, televisions, radios, telephones, perhaps Lillian would still be living.
Along with hard questions, there are endless acts of tribute to the gunman's unsuspecting victims.
It's absolutely devastating.
Erin Barclay knew 5 victims, including teacher Lisa McCulley, known as a dedicated mother of 2 children.
Nobody in their right mind would want to kill her or anybody.
There's probably not a child in this school or any of the local schools that don't have a relative or a close friend that passed away over this weekend.
People in these hardest hit communities also crave a day that doesn't reveal even worse information about what happened. Ross Lord, Global News, Debert, Nova Scotia.
The Canadian military has said it will be supporting the investigation in Nova Scotia, providing tents, generators, and lights to help protect and process the crime scenes. About 30 forces members will be involved. This crime leaves a huge hole in the community and in the hearts of those who are grieving tonight. Sometimes it's editorial cartoonists who capture the moment best. This one is by Brian Gable in the Globe and Mail. Communities in Nova Scotia are facing not just the terrible loss, but the fact they can't gather together to grieve. Because of the pandemic, funerals are limited to 5 people, immediate family only. Mike Drolet has more on those who were killed and those who are mourning.
Retirement in Nova Scotia was always the dream for Frank Lynchen and Dawn Madsen. They'd bought a home and lived apart as Frank fixed it up, and only recently reunited to enjoy a calmer East Coast lifestyle.
Just to finally, reach her dream, to have it taken away 6 months later, it's horrifying. It's essentially not what she worked her life for.
Dawn had worked for 18 years in food service at a Toronto area retirement home.
She will always hold a special part in my heart,
where she was remembered for treating and advocating for all the residents as if they were family.
Tell you straight up, whether it's going to be negative or positive, it didn't matter. She was honest, totally honest. There are times that I didn't want her to be that honest, but nonetheless, I do appreciate the fact that she was honest and gave me the feedback.
So much is still unknown as to what happened and how any of these people could be linked to the madness that unfolded over the weekend.
It makes absolutely no sense, and it's extremely tragic.
Chris Williams, now retired from the RCMP, trained to become an officer with Constable Heidi Stevenson in 1995. He says she never changed over the years. She was always that East Coaster with a big heart and a bigger smile. His sadness at the loss of a friend is mixed with the need for answers.
I think we all have questions. First and foremost, beyond the details, I just want to say that my heart goes out to Heidi and to her children. I cannot imagine the loss that they're feeling today.
How can anybody imagine any of it? Joey Weber lived far away from the crime scenes, but fate had him doing an errand for his family, which he valued above all else.
I would regularly see him on my morning drives into City Hall, taking his children to the bus stop, and he always had a big smile and always waved.
The victims came from all walks of life, brought together in a way never thought possible. Mike Drolet, Global News, Toronto.
The Queen has sent a message of condolence to Nova Scotia. She writes that she and Prince Philip are deeply saddened by the appalling events, and she offered words of support for the police officers who she says are selflessly responding to these devastating attacks, and to the emergency services who are supporting those who have been injured and affected. After any incident of mass violence, the question often turns to how those responsible acquired their weapons. Mike Couteur is with me from Ottawa. Mike, this tragedy in Nova Scotia is bringing some legislation back to the forefront.
Well, Donna, police still haven't said what gun or guns the shooter used to inflict so much damage over the course of nearly 14 hours in Nova Scotia. But that hasn't stopped the federal government from talking about gun control legislation. The Prime Minister has continually said the focus right now is to support the families of those who lost loved ones. In the same breath, Justin Trudeau talks about gun control legislation that his party was ready to introduce before Parliament was suspended due to the COVID-19 outbreak. Now, we still haven't seen the bill just yet, but it would likely be based on their campaign promise, which included a ban and buyback program on what the government calls assault rifles, giving cities the power to restrict or ban handguns, and red flag laws for people who could be a danger to others.
The legislation on the assault rifle ban was almost ready to go when the Parliament suspended. So I expect that'll be the first measures we bring forward. But of course, as we learn more about this terrible, terrible tragedy in Nova Scotia, we will keep reflecting on ways that we need to help Canadians stay safe.
Now, any new gun laws will have to wait until May 25th at the earliest. That's when Parliament is scheduled to reconvene. The special in-person and virtual meetings of the House of Commons over the next month are only to discuss matters related to COVID-19. Donna?
All right, Michael Couture in Ottawa, thanks. Now, to the other story that's dominated the news and your lives for more than 6 weeks now. There are more than 38,000 confirmed cases of COVID-19 in Canada and more than 1,800 deaths. The number of new cases varies widely depending on the region, and Ontario and Quebec have the biggest numbers. In Ontario, more than 11,000 people are known to have COVID-19, a jump of 551, and more than 600 people have died. Quebec has more than 20,000 confirmed cases, a rise of 807, and 102 more people died there, bringing the number of dead in Quebec to more than 1,000. That is the most of any province, and the majority of those who died, 850, were in long-term care homes or other senior residences. Staffing in those facilities has been hit hard too. Quebec said today about 1 in 5 positive cases are healthcare workers. Mike Armstrong explains the huge toll that's putting on the system.
Going into this crisis, experts knew long-term care facilities were vulnerable, but COVID-19 got to them anyway. Well, the professional orders representing Quebec doctors, nurses, and auxiliary nurses announced Tuesday a joint investigation into what went wrong.
Alors, est-ce que c'est l'information qui a été mal donnée?
The head of the auxiliary nurses says they want to know whether it was a question of training or equipment shortages or something else that let the virus in. What's happened has been devastating. In Quebec, 300 long-term care facilities have had at least one case. The outbreaks in 80 are still not under control. One of those facilities has now had a first healthcare worker die. Vicky Salvant worked as an orderly at the Grace Dart Centre for 25 years. Her last shift was April 11th. She died of COVID-19 just 6 days later. It was a reminder to everyone the work being done in these facilities can be dangerous.
I think about it every day.
Quebec's healthcare minister says she's well aware of the danger and the toll it's taking. In a province with just over 20,000 COVID-19 cases, about 1 in 5 is a healthcare worker. In some areas around Montreal, the ratio's even higher. Between positive tests, preventative leave, burnout, and anxiety, about 6,000 healthcare workers are off the job. For the ones still working, there's frustration as supplies of protective gear are only starting to fill the demand.
We're playing catch up, and obviously our members, all of them, are asking questions about this type of thing.
More and more of the government's focus is now targeting long-term care facilities. One plan that's just started is to move healthcare workers from other parts of the province to hard-hit areas like Montreal. They'll be put up in hotels and dedicated to one facility for 2 weeks. Mike Armstrong, Global News, Montreal.
A worker has died from COVID-19 and hundreds more are sick after an outbreak forced a meatpacking plant to close in southern Alberta. The Cargill meatpacking plant employs more than 2,000 people. It's now the largest outbreak in Alberta. A woman in her 60s who worked there died, and more than 480 cases are connected to the facility. 360 workers are known to be infected. Many other positive cases are connected to carpooling and other living arrangements between the employees. The Prime Minister confirmed today that 2 planes, one chartered by the federal government, the other by an unnamed province, flew to China to pick up personal protection equipment for frontline healthcare workers in Canada, but came back empty.
There are severe restrictions on the ground in China in terms of how long a plane can actually stay in their airports before having to leave, whether it's full or not. And at the same time, supply lines and truck shipments to the airports are difficult and interrupted by checkpoints and quarantine measures. For the most part, we've been able to navigate through those and ensure that Canada has received the equipment that it needs, but these 2 airplanes were forced to take off empty.
Canada's largest airline is suspending all scheduled flights to and from the United States starting on Sunday. Air Canada says it made the decision after the 2 countries agreed to extend border restrictions for another 30 days. The company hopes to resume flights on May 22nd, but that depends on further government restrictions. Air Canada has reduced scheduled flights by more than 90%, but it was still running flights to 11 U.S. destinations to help repatriate Canadians. Those will all stop on April 26th. Getting back to normal in the U.S. Coming up, the state's set to reopen in just days. In the U.S., some states are moving ahead with plans to reopen some non-essential stores and services, despite the fact the number of people who have tested positive in the U.S. for COVID-19 is now past 800,000. We know not everyone who has it has been tested either. More than 45,000 people in the U.S. have died. As Jackson Proskow reports, doors could be open to the public in some places as early as this week.
In small but vocal groups, protesters across the U.S. are demanding a return to regular life.
Open America now! No restrictions!
Even as the virus spreads, as cases and fatalities surge by the thousands each day, they're fighting stay-at-home orders.
It's not a pandemic, it's a panicdemic.
Message received in Georgia, where the governor announced plans to reopen everything from barbershops to bowling alleys by week's end.
We will get Georgians back to work safely without undermining the progress that we all have made.
Progress means 500 new cases of COVID-19 in the past day, adding to the 18,000 cases and 800 deaths in the state.
As I talk with our public health officials, I don't see that it's based on anything that's logical.
Georgia isn't alone. South Carolina and Tennessee are lifting restrictions too.
We have to be able to accelerate as fast as we can and as safely as we can.
Not one state meets White House guidelines for reopening the economy. The Trump administration refuses to push back.
Each of the governors can decide for themselves whether they've reached specific guidelines in specific areas.
To safely end lockdowns, experts have said the U.S. will need to test as many people every day as it currently does every week. But the White House seems preoccupied with a different fight. Overnight, President Donald Trump tweeted plans to stop all immigration to the U.S., a move meant to shore up his base of support at a time when America's borders are already effectively closed. Jackson Proskow, Global News, Washington.
Is Kim Jong-un unwell ahead? The mystery in North Korea.
You're watching Global National.
There's some confusion tonight about the health of North Korean leader Kim Jong-un. Some unnamed U.S. officials have suggested he might be in grave danger because of heart surgery, but a top South Korean official says Kim Jong-un is conducting normal activities. These pictures are from the last time he was seen in public, hours before that reported emergency surgery. That was on April 12th. Questions about his health were raised after he missed a birthday celebration for his late grandfather, North Korea's founder, one of the biggest events on that country's calendar. There's no doubt about the health of one of the most enduring world figures. Queen Elizabeth turned 94 today and spent the day quietly at Windsor Castle. The palace said the longest reigning monarch in British history would not mark the day in any special way. She's in self-isolation with her 98-year-old husband, Prince Philip. The palace did release rare private footage of then Princess Elizabeth as a child playing with her younger sister, Princess Margaret. Making masks and making a difference. Next, entrepreneurs give back during the pandemic. This pandemic has changed our lives in so many ways, but it's also brought out the best in lots of people. People making sacrifices to help others and giving back. A group of entrepreneurs in Toronto is doing that. They're helping the country that welcomed their families with open arms. Abigail Beeman has more on their Made in Canada solution to a problem facing the whole world.
This is a clothing factory that completely changed operations inside a week.
There's a real need right now to relieve pressure on medical grade masks for people who need it the most, but also that, with COVID-19, there's been the economic hardships of people losing their jobs.
A small but quick-thinking team came up with a plan to make non-medical masks.
I asked a lot of questions about what would you do if you couldn't have first best, what's second best?
The initiative is called Take Care Supply, the masks designed by Anna Maria Mountfort.
There's no designer without the sewer. There's no restaurant owner without the farmer. We are all related.
They're made by workers rehired after losing their jobs in the COVID-19 crisis.
I'm happy for working here.
Everyone behind the project has a unique perspective about giving back.
My mom's from Vietnam and my dad, Ali, is from Iran.
All first-generation Canadians.
My mother's side of the family is Polish, Holocaust survivors. My dad is Chinese, orphaned at a young age. And I think it's really important for people to see how the immigrant community in Canada is the one that's holding us up right now.
I'm really proud to be a part of this because, and to be able to help Canadians. And that's because when my parents were in need, when they were refugees from the Vietnam War, Canada, in an incredible act of compassion, decided to welcome my parents and other boat people when other countries are closing their borders.
The initiative's so popular, they've already sold 100,000 masks. They're for non-healthcare workers, but the need is so pressing, doctors and nurses have been calling too.
I will personally go in and actually prioritize their orders.
The message for everyone: take care. Abigail Beeman, Global News, Ottawa.
And that is Global National for this Tuesday. I'm Donna Friesen. In times of tragedy, cartoonist Michael Adder is known for capturing the mood of the nation. Today is no different. We leave you tonight with his tributes to the victims of the shooting in Nova Scotia, his home province. Shoes surrounding the boots of the RCMP Constable Heidi Stevenson. And last night's beautiful sunset sky over Nova Scotia brought a bit of solace to people too. Many Nova Scotians took to social media to share the stunning view with the hashtag Nova Scotia Strong. Thanks for watching. Take care of yourselves.